Welcome to another video. Today is the first episode in Professionals, and today we're here with Dr. Jackson. He's going to be showing us about ophthalmology and how to do eye surgery.
Welcome to the operating room. We'll just show you around at one of Arizona's premier centers of eye excellence. This is the operating room. As you can see, we're not doing surgery today. Everything needs to be terminally clean, but just so you can take a look around. State-of-the-art equipment, the Artivo 800, also other equipment that allows you to do safer and more effective surgery. This is where the magic happens. 95% of what I do is cataract surgery. The primary cataract surgery, usually somewhere between 10 to 21 minutes. For primary cataracts, the surgery is essentially painless. There is one part where they feel a little bit of burning for about 10 seconds as medicine is being put into the eye. But essentially it's a painless surgery. Is it affordable? Yes, it is affordable from the standpoint of insurance covers it. Sometimes when people have high deductibles, that is pricey. Also for those individuals who have scarce resources, the Center of Excellence has provided some opportunities for them to be able to receive needed eye care at either free or reduced prices. Generally, the symptoms are glare, halos, decreased color, or contrast sensitivity. I do somewhere between 20 to 60, sometimes 80 surgeries a week. I was born and raised in Las Vegas. When I was growing up in Vegas, my first job was working at a plant nursery. I loved working with my hands. But on my mission to Guatemala, I had the distinct impression that I was going to be a doctor. It was my very first area in Santa Barbara, Suchitepeques, which was in the coastal region of Guatemala. And little Brian Ordonez, who couldn't have been over 10 years old, because he didn't have enough money to go to school, he was out in the sugarcane fields harvesting sugarcane, overswung his machete right into the palm of his hand. Prior to that, the reason why I didn't think I was going to be a doctor, I didn't think I was smart enough. I thought all doctors came from rich families, and my dad was a teacher. And also, I didn't like blood. There I was in Guatemala, and I just come from the United States, and I had a little first aid kit, and saw that Brian had sunk a machete into his hand, and we unwrapped his hand, and it was wrapped in this oily rag. And I went ahead, I wasn't sure how I was going to feel, but when I was there to help and assist, all of a sudden it wasn't scary. I had this overwhelming feeling of honor and respect for the human body, and an impression of, Todd, this is what you're going to be doing. And then after my mission, my undergraduate degree was in accounting from Brigham Young University, and then I did a minor in zoology. And sure enough, when it came time for me to apply, I studied really hard for the M.P.H. Applied to like 52 schools, I think. After I got back from my mission, I got married, and my first child was born with a congenital cataract. So here on the back of my mind, God had said, hey, you're going to be a doctor. In fact, most likely you're going to be an eye doctor. Because when you're trying to pick your career, you want to pick a career in which you apply the talents you already have. You're always supposed to develop new talents, but if you someone told me once, they said, pick something that you can do in your life that in your free time, you choose to do that and time just flies by. During medical school, you rotate through all different surgical specialties. And some of the surgeries were hours and hours long. I mean, some of the heart, lung transplant surgeries, brain surgeries, they were hours and hours long. And I thought, wow, I think I do much better with shorter interval surgeries. So ophthalmology was just perfect. The physics of the eyes is very, very fascinating. Technology is always changing. Every 6 months there's something new coming out where technology is being applied in such a way that it gives patients better outcomes. During medical school, I had three different things. My reach for the stars was ophthalmology. My middle of the road, I thought I was going to do OBGYN or family practice, and it turned out, because of personal experience, because of clinical research, and because of some blessings, I was able to get into ophthalmology at the University of Houston. Came out and started a practice in Vegas, and eventually came out to Arizona, where really this is my dream job, to be able to have 75% of my time in the operating room and being able to utilize the talents and skills that I have to serve patients and restore their vision, and be able to utilize those opportunities to serve others, both locally, my family, and internationally. Actually, this month makes 10 years of doing practicing ophthalmology. If you include residency, that would be 13 years.
Thanks for watching this episode of Professionals, and thanks for having me, Dr. Jackson. We'll see you guys in the next one.
All right, I'm not gonna lie. One of the best perks about being a doctor is the free food.